In today's Frontline Diaries segment, we connect with Dr. Marc Carrier, hematologist at the Ottawa Hospital. Dr. Carrier, does having COVID make you more likely to develop blood clots?
Yeah, unfortunately, data from initially China and Europe and then now from North America have shown that COVID patients are more likely to develop blood clots while they're sick in hospital. There's no doubt that as patients are getting sicker and sicker, and some of them unfortunately will need to go to the intensive care unit, for example, the amount of patients that we see with blood clots is increasing.
And is that process as simple as maybe a higher dose of a blood thinner to try to keep people off ventilators, out of the ICU?
Yeah, we think it might be. So usually patients, when they're admitted to hospital, when they're sick, they receive a small dose of blood thinner to make sure that the blood is thin enough not to have any clotting complication during their hospital stay. With COVID patients, because we see a bit more of these blood clots happening, we think that maybe increasing the dose a little bit of these blood thinners during the hospital stay may hopefully prevent from the disease from getting worse and then for patients to go to the intensive care unit over time. The blood clot unit in Ottawa is very, very world famous, and it was just normal for them to take the lead and design the protocols for our community to make sure that when patients need to be admitted to hospital, they have what we think is the optimal dose of blood thinners to prevent these complications from happening.
It's all fascinating stuff, and while you're busy looking at all of this and involved with the trials, you also had to undergo, I guess, that whole transition that so many medical professionals did from face-to-face care to virtual care. That had to be a bit of an upheaval in your practice.
It's amazing that this whole thing happened within a week, and practice has changed completely. And if you go into the Ottawa Hospital right now and you go to the different module, if you come to our module in Module H, you see there's hardly anybody in the waiting room. Actually, we're only allowed to have 11 patients at a time in the waiting room just to make sure there's social distancing. But if you go into the back room where all the healthcare providers are sitting down, it's very busy doing phone calls and making sure that we're trying to get through everybody, making sure everybody's doing okay.
It's interesting, in talking to doctors and nurses on the front lines these past several weeks, the people who are out there caring for our physical health, it seems this has been a trigger for a lot of you to start thinking about your own mental health and wellness and self-care. Have you experienced that yourself?
Yeah, I have to admit that, if we go before COVID, and if you would have looked at in a dictionary in a definition of mindfulness, I would probably be the antagonist of mindfulness. I didn't really do any of it, didn't really believe so much in it. But with COVID and the long days at work and the additional stress and all the transition we had to, I slowly became mindful over time. I downloaded an app to help me during the day, and now I'm trying to meditate and be in the present moment. Of course, the occasional beer helps as well, but I've been really discovering mindfulness. For me, it's been the trick to help me stay sane during the pandemic.
Well, cheers to that on both fronts, Dr. Marc Carrier. Thank you so much for your time. Best of luck to you going forward.
Thank you very much for having me.